It's really hard to imagine what these patients are going through. I try to put myself in their shoes. So how can I help them? How can I make their quality of life improved? My name is Stacy Douberly, and I am a clinical audiologist at the Penn Medicine Division of Audiology. I was originally interested in becoming a speech-language pathologist, but in my undergrad program, I just happened to fall in love with the audiology aspect and decided to pursue a career in audiology. Being an audiologist, we're able to help restore hearing, and I see the impact it has on the patient's families and loved ones. Helping a patient be more safe in their environments because they can hear better. Helping restore communication abilities between a husband and wife or a parent and child. So we're really impacting not only their overall safety and their ability to hear sounds present in their environment, but also to connect them back to their loved ones and their friends, because that's what's important in life. Being able to become a part of these patients' lives is very rewarding and really fulfilling for me.